It's Dr. Dan Edney, State Health Officer. Good morning, sir. How are you on this Friday?
Good morning, Paul. I'm doing well, and you?
You listen. I don't think as many people we've had on here from their office. Never have we ever had anybody in a rocking chair. Is that a
Well,
rocking
listen,
chair?
and if you hear background noise, that's my grandchildren, and you're going to have to deal with it because they are grand.
I envy you. As a matter of fact, I think we ought to replace the shag chair here with a rocking chair. First of all, I've got to ask you this because I said I was going to ask you your thoughts or statement or inside analysis on the statement because on this situation in Tunica, because it does kind of involve the Department of Health when you have 2,000 children moving in from another country, unvaccinated, et cetera, et cetera. Your thoughts on that story about a possibility that they will be housing 2,000 in the old Grand Casino in Tunica County?
Yeah, but that being a specific federal program with being the undocumented, unaccompanied minor program of the federal government, that is a specific program, I believe, of CPS and is not in our jurisdiction. We looked at it thoughtfully to see what role, if any, we would have, because we do regulate child residences like the Palmer home. But it's not within our jurisdiction. In terms of vaccination, that's one of the very first things that happens for any undocumented coming into the country. They have to go through health screening and have vaccination updates done, and certainly the children for their safety and the safety of others.
So are you saying that you're pretty confident that these kids have been vaccinated?
They will be by the time, if there is a facility in Mississippi, they will be by the time they would get here, because these are children that are in federal custody. So the federal government is actually the custodial parent for them.
And that's a very good way to put that. Since that's the case, will there ever be a situation where they would come under the purview or have to abide by some of the same rules and regulations if they stay here, of course, go to school? At what point does that happen?
Well,
will they leave the facility or when?
And those are questions, Paul, I don't have the answers to. Yeah. Certainly, if any of those children were educated in the public school system, they have to conform to the laws of Mississippi. I don't know if that's the case or not. Their food service that would be provided on site would be regulated and licensed by the health department. And of course, any outbreaks that would occur would be within our jurisdiction.
So, since it is such a nascent story, a lot of people, and I'm sure the governor's office is thinking the same thing, not sure exactly where they could get involved in this. And it's the same thing probably every state's governor, health department has had to answer those questions when they found out that there had some coming to their state. That's not what we got.
And Paul, this is a federal contract that's out for request for proposals. So this is not the federal government sending them here. These are organizations that are trying to get the federal contract. So it's, Mississippi is one of the options for them to come to, should that work out. But it's not the Fed sending them. It's entities that are wanting to answer the RFP and produce a facility that the federal government would use and contract with to house and take care of these children. These are children that don't have parents with them. They're all by themselves.
I understand. Well, they have to have some adults with them, wouldn't you think? I mean, who's going to be there to oversee the kids, 2,000 kids in a location, even if it's not 2,000, even if it's 200? And I think we're talking about maybe 1,500 to 2,000 as far as max is concerned. So, I mean, you got to have some adults in there somewhere.
Yes, they just don't have their own family with them. These would be those that are administering the federal contract.
Understand. But
kind of like the Palmer home for undocumented children.
We're speaking with Dr. Dan Edney. But the program that they are here that clears them is a federal program, right?
It is. Absolutely. This is
Okay.
definitely a
All
federal
right.
program, and it's a federal contract. And you're asking the wrong agency head, my friend.
I will. I'll let you off the hook here, and we'll go to something else. It is the 50th anniversary of EMS
It
this
is.
week, and we have made a tremendous inroads over the 50 years, wouldn't you say?
Oh, amazing inroads. And in fact, EMS is maturing into a clearly distinct part of overall healthcare. And that's been part of my message at the last legislative session was the importance of EMS. And
Mm-hmm.
it's important for all 2.9 million Mississippians. So this is something that you and I both certainly at our age want EMS to be healthy and ready for when we have to dial
Yep.
911. But it's needed for every single Mississippian, and it's not just the great work they do on an emergency run, but being prepared to respond 24/7, 365 to help take care of us in Mississippi. And they are much more than transportation, Paul. We're way past the days of load and go like it was 75 years ago. Now,
Yep.
EMS is the entry point to healthcare. Whenever I have my heart attack or my stroke, I don't want to wait to get to the emergency room to start treatment on me. Physicians want treatment to start immediately. So oftentimes that happens in the home with 911, or it may happen on the side of the road with trauma, or it may happen in the back of the
Mm-hmm.
ambulance on the way to the closest cath lab for heart attacks. We don't want people getting into the car and trying to make it to the hospital. We want them to dial 911 and let our EMTs and paramedics come to the rescue, make the diagnosis under the care of the regional medical director for EMS, and initiate treatment under the care of that medical director with the expert training
Yeah.
that they've had.
I think, Dr. Edney, anybody who thinks it's just transportation should climb in the back of one of the ambulances of today and see the
Absolutely.
sophistication of that. It's like an
Oh, it's
operating
they're
room.
rolling ICUs,
Yeah.
and a great point of why it's more than transportation. Our paramedics and EMTs rescue a lot of people in the home that don't need to go to the emergency room after that. We call it treat in place. And this year we finally got legislation requiring third party payers to recognize that as a true service. Before this year's legislation, if they didn't go to the emergency room, the EMS services were not reimbursed. So if you had a diabetic whose blood sugar bottomed out and you got them back stable and they didn't go to the ER, they didn't get paid, or they reversed an overdose. Uh, they didn't get paid. So now we're really preaching that they are the entry point to healthcare. We need care to start immediately, not in the emergency department.
Yep. I think it's changed in the last few years, but for so long, just trying to get the legislature to understand the importance of EMS, it was almost like an ancillary thing. And thanks to you and other people, and my son Mark has been involved in this, as you well know,
He
for
has.
a long, long time. And we've changed a lot over the last few years. I think the worst thing I've ever heard was we had somebody on the air. This has been a long time ago. He said, and I'll never forget this. He said, these people in EMS and the paramedics, they are so efficient now. They are so good at what they do. They bring people to the emergency room alive that should not be alive because there's no
That's
way
right.
to save them. And they are a drain on the medical because normally they would be dead and there's no way to save them. I thought, wait a minute. And it took me a couple of years to figure out if that was a compliment or, or a slight to them. But I'll let you speak to that when we come
Paul,
back in just a moment. Yeah. Hold on. We'll be right back. Rock away
all
for
right.
a couple of seconds there. Back with more and Dr. Dan Edney in just a second. All right. Let's go back to the conversation with Dr. Edney in talking about the evolution of care within the EMS and what's next, what's the future hold, and how can we make the system even better?
Well, we've got to do a lot of work on that because one of my main concerns over the last year has been the stress that EMS is under. You were listing several wonderful attributes of our EMS professionals, but let me tell you something, some other things they are. They are overworked and they are underpaid. And the reimbursement towards EMS services is woefully low by all payers. And there was
Yes.
some that was addressed in this session to some degree this year, but the workforce is very low. We need about 3 times the number of EMTs and paramedics than we have in the field today. Compensation is too low because reimbursement is too low, and if and we're putting more strain on EMS through our systems of care with heart attack, stroke, sepsis, trauma. Very soon, we'll be having an obstetrical system of care for high risk perinatal care, and that all relies on EMS. And then we have the new hospital designation, rural emergency hospital, where our smaller hospitals are giving up inpatient services and for higher reimbursements from CMS. But that means they have to transfer to a higher level of care within 24 hours. So, and guess who does that? That's going to be EMS. So 18 months ago, I was really concerned about the rural hospital situation. I still am, but not as desperately as we were 18 months ago. And this session, I was really trying to raise awareness on the challenges that EMS is facing, because we don't need to assume that it's just going to be there, Paul. We have some areas of the state that is extremely fragile. And if we are not thoughtful in making the right decisions for healthcare in this area, we could have areas of the state without decent EMS. But we had a lot of good attention in the session, and things are better.
My question was, are there areas of the state that don't have it at this time?
Not everywhere has it now, but we have a lot of counties that will have only one ambulance. And if we need to take you from Sharkey County to Warren County with a heart attack to get to the cath lab, and that leaves them short, then we're in trouble. We don't have enough capacity or redundancy, because we're a 50-year-old system, which we celebrate, but we're still operating much like we did 50 years ago. And EMS has to evolve and move forward the same as the rest of healthcare. And we have a lot of good folks working on policy to help that move forward. The legislature paid attention to it. The governor paid attention to it. Board of Health is paying particular attention to it. And I can promise you I'm paying a lot of attention to it. We need a more regional approach instead of a county approach.
That's good to know, because you scratch your head and wonder, why in the world doesn't the legislature give it the same importance as a nurse shortage and nurses' pay, et cetera, et cetera? And it's never been up to that level, and it is a conundrum, and I don't understand why.
Well, it changed this session because your state health officer got neck deep in it, because the consequences were too dire for the population of the state for EMS to become too weak. And so every opportunity I had to testify, every meeting that I was in, every time I was on one-to-one behind closed doors, I was raising awareness of EMS. And that's my job, is to identify the healthcare crises of the state and raise awareness, and then help bring solutions, not just whine about it, but bring solutions to the table so our decision makers have what they need to make the right decisions.
Is there?
I'll tell you another challenge, Paul.
Yeah, go ahead.
Another challenge is, we have the highest rate of uninsured, 18 to 64. So our ambulance folks are having to do a lot of uncompensated care.
It's one of those things that you scratch your head and you say, okay, this session, let's solve those situations, and it's like anything else, I guess. It just takes time and incrementally done. Anything else?
But they did good work this year.
Are there any parties or anything, since this is the anniversary, or is there a crawfish boil, or is anything going on that we can get a free meal out of?
Well, not you. I don't think you're invited. But yes,
Well,
there's
thank
the
you.
EMS. The EMS gala is coming up very soon, and your son
Yeah,
Mark, who is the
yeah.
president of the EMS Foundation, is doing a great job leading that. And I want to make sure I give a shout out for the new EMS
Mhm.
memorial that was finally passed this legislative session. And I'll have the honor of working with the EMS Foundation for us to design the memorial, construct it, and give it a safe, respectable, high-profile home at our central campus at the health department in Jackson.
I found out about that. I think it's a great idea. Thank you, sir.
Me
Appreciate it very
too.
much. Have a good Memorial Day.
Thank you, my brother. You too.
And I guess I can say this safely, rock on.